Ashley Mazuri, KTN.
Meanwhile, the Ministry of Health was at pains Wednesday to confirm whether it owns or has control over the healthcare information technology digitization system that has come under scrutiny following a damning Auditor General's report that exposed procurement and ownership breaches of the 104 billion shillings Social Health Authority system. This, even as the authority dismissed claims of an existing escrow account where SHA funds are allegedly transferred. Here now is Gloria Milimu with the detailed report.
The president addressed that yesterday.
This was the response on whether the government owns or has control over the controversial healthcare information technology digitization system that has yet again come under sharp scrutiny over its procurement. Health Cabinet Secretary Dr. Deborah Barasa seemingly evading the questions over the system's ownership. The Auditor General, in her 2023-2024 report, had revealed that Kenya neither controls nor has rights to modify the 104 billion shilling system run by a Safaricom-led consortium comprising of a Payroll Limited and Convergence Network Solutions Limited, putting the government at risk in the event of growing needs for technological changes.
These issues have been comprehensively addressed by the accounting officer, who is PS, Medical Services. And again, they will be expounded more exhaustively in Parliament if given a chance.
Health experts have warned that the absence of a fallback system could compromise service delivery in the event of a digital system failure.
With this system, we believe that we can be able to really minimize on corruption, have transparency and accountability. And that's why we are saying again and again, it will be published on a platform that each one of us can access, interrogate and scrutinize.
In what now appears to be confirming fears raised by experts on the system having been rolled out in a rush before proper sensitization and training for healthcare workers was done, despite 7 billion shillings being set aside to facilitate that, the ministry says plans are now underway to develop a manual in the next 3 weeks to help equip the healthcare workers with the necessary information on how the system works.
Many times people go to the facility, the health worker who is dealing with you is not familiar with the system, and instead of asking for help, he or she tells you that SHA is not working just because he or she is not familiar with the system.
Meanwhile, the Social Health Authority has dismissed claims that SHA funds are transferred to an escrow account daily or at a frequency of not less than 1 week, as captured in the Auditor General's report. SHA says all the monies by the authority's contributors are collected via 6 banks. They include Equity, KCB, Cooperative Bank, ABSA, CDN and Diamond Trust Bank.
There is no single cent that goes somewhere else. The only money that leaves those accounts goes to pay hospitals.
Meanwhile, President William Ruto has assured all Kenyans that any challenges being experienced in the implementation of Taifa Care are being attended to and resolved. Currently, only 20 million Kenyans have registered with the authority as members of SHA. Gloria Milimu, KTN.